to go there. First of all, who is Whitaker and why was he or she suing? And one of those cases was about saw palmetto, wasn't it? Saw palmetto and its influence on the prostate.
Yeah, I do think, I can't tell you, there was a series of Whitaker decisions. I don't recall which specific one. But so Dr. Whitaker is a alternative care provider he was in California, and he had a very successful practice. And he therefore, because he also, not unlike Dr. Wallach, he had a lot of patients who he treated, and his desire was to try to, obviously spread the dissemination of information related to helpful products that could help his patients and otherwise. And so he was the named plaintiff on those cases. There were actually, I think, a series of them. A lot of those who participated in the Pearson decisions, but the case is named because he was the first named plaintiff. And so Dr. Whitaker was one of the sponsors of that lawsuit. It started with Whitaker 1, which was focused on the antioxidant claim, which was related to risk reduction of cancers. And from there was a series of those that followed. In each instance, the cases that followed were a direct result of the FDA simply not doing what the court had instructed it to do in the Pearson cases, which was to try to apply reasonable disclaimers to the claims that could be appear on product labels and websites and whatever else in common.
Things that comes to mind to me is, just as an example, let's just say statin drugs, right? Mm-hmm. Now, we're typically of the belief that statin drugs are no bueno, right? Mm-hmm. So you go on social media and you say this, and there's a lot of doctors and health professionals saying it now. They're speaking out that statins were a bad idea, blah, blah, blah. So at what point do the alphabet boys, at what point do they say, you're an influencer and you're influencing random people to stop taking their drugs? And that's bad.
Yeah, I mean, again, so scientific speech also has its own special protections under the First Amendment, and so any effort to try to curtail that activity is deeply problematic. And we've seen that. I mean, it's yes, the government tried during times of COVID to stifle a lot of speech, similar speech, but a lot of the real limitations didn't even come from the government. They came from private parties like those who own social media. And so that's a different equation because that's not governmental conduct. And so, constitutional limits aren't, it's at least less clear that any protections apply there. But when the government would be involved in speech that you're making, for example, again, they need some kind of a regulatory hook. And so they need